So the other day, I was in Malkohi IDP camp in Adamawa State. I basically just went to do an inspection of an IDP camp in preparation for the Victim Support Fund COVID-19 interventions that I've had the privilege of being chairperson for the last couple of months. And then I used the opportunity to demonstrate social distancing to some of the IDPs. Aside from food, medical items, and PPEs that the Victim Support Fund has been donating over the last few months across 19 different states of the country, broken down into phase 1, phase 2, and phase 3, the power and the role that information could play, and the importance of 3 very crucial things. The first one being inclusivity, the second one being innovation, the third one being institutions. In the last 6 to 7 months, we've seen the very first phase of the intervention begin from Malaysia Gardens in Abuja to Borno State, to Yobe, to Adamawa, to Taraba, to Lagos, to Ogun. And then, that phase covered in a 1 billion naira intervention, specifically providing rice, beans, vegetable oil, salt, PPEs, primary healthcare, secondary healthcare, multivitamins, anti-diabetes, anti-hypertensive drugs, especially because people that are about 50 years of age and above are the ones who are most, susceptible to coronavirus. And then the second phase of about 882 million, targeting, the South-South and the South-East locations and competing in the Southwest, specifically Ondo, Delta, Enugu, Ebonyi, and Ekiti State, in addition to supporting the development of the Pandemic Response Action Plan of the federal government, providing IT support for the COVID-19 Secretariat of the Federal Ministry of Health, and also making sure that we support public response institutions like the NCDC to be able to do their data gathering and monitoring across all the 36 states from one location in Abuja. And then the third phase, specifically completing the Northwest and the North Central regions, but moving on from just giving food items to more enduring interventions, like, providing solar-powered borehole facilities for 54 secondary schools across 18 different states, cut across all the 6 geopolitical zones. And this is because, according to WaterAid and UNICEF, only about 10% of Nigerians have access to running water. And that reminds me of that story in Malkohi IDP camp. How do you tell people to wash their hands under running water when the nearest access to water that they probably have is a stream that is more than 20 kilometers away? And then you bring it back to the 3 pillars I talked about earlier, the importance of inclusivity, the grim realities that stare the 2 categories of citizens of Nigeria in the face. Research and statistics say we're the country with the highest number of poor people in the world. And then I think about that in the context of equal opportunities for our country. How, if you gave education and economic empowerment to the children of the poor, we'd have less IDPs in IDP camps, and you build a system where there's more inclusivity and people have access to the basic needs of life without having to depend on the sort of aid that the VSF and other organizations are providing. You think about innovation. How do you do things differently? For example, at the VSF, we've prioritized the data-driven monitoring and evaluation plan end-to-end, from the point of a needs assessment that helps us to decide exactly what we should be giving to what community and what state, to a price intelligence system that makes it fair enough for us to judiciously manage and allocate resources and make sure that we prioritize the dignity and the wholesome nutritional well-being of our intended beneficiaries, such that we don't just give them gari without giving them beans, because carbohydrate and protein are both important. To the standard profiling of our beneficiaries. Who exactly do we want these items to reach, and where are they? What local governments are they hugely concentrated? And then you think about that, and how do you do what is being done in a different way, with a different type of thinking, with a different level of competency by people that have conscience? And then you take it to the third pillar, which is institutions. A country that is not dependent on the whims and caprices of individuals, but is dependent on carefully designed systems, structures, and procedures that can work irrespective of who's taking charge of what responsibility. And when I think about the work that we've done at the Victim Support Fund and the sort of impact that we've made over the last couple of months, my greatest lesson is that coordinating humanitarian support for indigent and vulnerable populations in the middle of emergencies or epidemics is possible in the hands of the right people. And if you use, carefully designed data systems to be able to find the beneficiaries you want to be able to, give these items. And at the end of the day, basic amenities should not be they're not rocket science. They shouldn't be luxury in our communities. They should be available. COVID-19 gives us an opportunity as a country and the world to recalibrate and rebuild our systems and our nation, such that the next time we experience a crisis or an emergency, people wouldn't die because of lack of basic healthcare access, or because there's no running water, or because someone was given resources to do a certain thing, or to carry out a certain type of responsibility, and they didn't do the needful.